Continuing on in your blood chapter, this is where we had left off with video number 2. We're on page 361, and we are starting the white blood cells. So the red blood cells carry the oxygen out to the body, a very important function. Your white blood cells is a completely different purpose. White blood cells, first of all, are called leukocytes. Leuko is med term for white. I don't think I talked about the red blood cells is erythrocyte, which erythro is med term for red. So the leukocytes, you probably have heard of leukemia, which is a condition of the white blood cells. The white blood cells are there to protect us. It's there for infections and other invaders in our body. Okay? Earlier in the chapter, we talked about they are separated between granular and agranular. Your granular, I told you I used the word basophils. B stands for baso, E is eosino, and N is neutro, and they all end in the word part of phil, P-H-I-L. So neutrophil, eosinophil, and basophil. So talking about them one at a time. Here we go. I'm like, I thought it came next, but it doesn't. They jump into the white blood cell count first. Remember your red blood cells, you have between 4.2 and 6.2 million in each sample of blood. Your white blood cells is between 5 and 10,000 is considered to be normal in that same cubic millimeter of a blood sample. We have the word leukopenia in med term. Penia means decreased or insufficient, so leuko is white. So we put it together, it becomes insufficient or reduced white. You have to imply the word blood cell in that definition. So it's an abnormally low count. It means that you have less than 5,000. It's not very often. However, in some immune-compromised patients, like an AIDS patient, that can lower their white blood cell count. More frequently is that you have a high white blood cell count, leukocytosis. Med term that literally means condition of white cell. So you have to know that this means a high count. Okay, there's nothing in that word that means high, okay, or increased. This means you have more than 10,000. This is common with an infection. So you have strep throat, you have an ear infection, you're going to have an elevated white blood cell count. Okay? That is normal. However, you see it also with blood cancer like leukemia. So we're talking slightly elevated over the 10,000, or are we talking highly elevated over the 10,000? That makes the difference between it just being an infection and it being cancer. We talk about leukemia later in the chapter. We can do a blood test called a differential white blood cell count. And with that one, we're not just giving you how many white blood cells you have. We can also separate it out into how many of each kind you have if we think that there's a problem with a specific kind of white blood cell. Okay, your neutrophils. Neutrophils is a cell that performs the process of phagocytosis. So this is a phagocyte. Phago means eating. Okay? So phagocytosis means that the cell is going to surround the invading bacteria and eat it, munch it up, and consume it from surrounding it. They actually take the cell into their own body and digest them in the process of phagocytosis. So neutrophil looks for invaders like bacteria in your body, and it goes to attack it in the process called phagocytosis. The next one is the eosinophil. This one is a weak phagocyte, so it kind of does the phagocytosis, but not as effective as the neutrophil does. This one is also looking for protection against infections, parasites, and parasitic worms. It also gets involved with asthma. So both of those are phagocytes. Basophil is not a phagocyte. Oh, look at that. 2 are, 1 isn't. Great multiple choice questions, right? Basophil secrete histamine. You might have heard, maybe you've taken a medication that's an antihistamine. You're trying to stop this process from happening when you take an antihistamine. But what a histamine does is it is released during inflammation. Okay. So if you have like a sprained ankle that's all inflamed, there's lots of histamine in that. It also produces heparin, which is a natural anticoagulant, which means stopping you from clotting. This is stopping the blood from clotting as it circulates in your body. We don't want it to clot inside of us. If I get a cut, I want it to clot. So inside, heparin is a natural blood thinner. Some patients may take a medication of heparin, also known as Coumadin or warfarin. Those are also medications that do the same process. Those are your granulars. Agranulars are your monocytes and your lymphocytes. A monocyte is the biggest leukocyte, biggest white blood cell. They are also phagocytes. So now we have 2 granular and 1 agranular, all of which that are phagocytes. Notice that. Okay. So they also engulf and consume, just like the other phagocytes. This is in your blood. However, if there is a large thing that needs eaten, like cancer, the monocytes will leave the blood and go into the tissue, and they are called macrophages once they leave the bloodstream. So it's a monocyte that has left the bloodstream becomes a macrophage, but it does the same thing. They have grown very big to be able to fight something very big, like cancer. Clearly, our body cannot get rid of cancer only in this process. Clearly, cancer is bigger than that, and it needs more. But this is a first process of how our body is going to try and fight it. The last one is the lymphocytes. Lymphocytes, we have an actual lymph chapter, which we'll be covering this module. We'll talk about your B cells and your T cells when we get to that other chapter. But lymphocytes also protect us from invaders, but these ones have a lot to do with our immunity. So like once you have chickenpox, you don't get chickenpox again. Guess why? Because of your B cells and your T cells. So the lymphocytes have a lot to do with your immunity. So what are some of the diseases? The big one is leukemia. You hear that one a lot. With leukemia, remember I told you that the normal white blood cell count is between 5 and 10,000? Leukemia means you're over 100,000 white blood cells. That's why I told you an infection is normal to have elevated white blood cells, but that's like a little elevated. This one's big elevated. It's 100,000. It's 10 times as much as you're supposed to have. So if you don't know you have leukemia and they do some blood work and it comes back with this kind of number, it's a big deal. Okay. There are 4 kinds of leukemia I'm about to go through. Guess what? This is not on the test. What leukemia is as a whole that I've already talked about, the elevated white blood cells, etc., is on the test. But these next 4, the CLL, AML, ALL, CML, are not. But you will hear these phrases in any TV show that talks about cancer. So we have chronic and acute lymphocytic leukemia. This one is for adults. It's rare in younger people. Average onset is about 65. Okay? These ones, typically you do chemo and radiation, but people live for many years even with no treatment. So this is, although it's rare, it's not the worst kind of leukemia to get. You gotta have one. This is the one to have. The acute version, however, is always going to be children, 3 to 7 years old. 80% of kids have this kind. So when you hear of a kid having leukemia, it's probably this one. However, it's highly curable in children, but not in adults. The next one, chronic myeloid leukemia, is about 20% of all cases, usually adults. The normal benphils, basophil, neutrophil, eosinophil, turn cancerous. So this one is a slow progressing disease, and this is typically going to need a bone marrow transplant. It's not a very good disease. It's a pretty gnarly one. And then we have the acute myeloid. The acute version of this one, 80% for adults, 20% in children is this kind of leukemia. It is sudden. Prognosis is poor. Only 50% of children with long-term survival, 30% of adults with long-term survival. So this is a really fatal one. Fortunately, most children don't get this kind. Most children is the other kind, which is the much more curable version. The next one for your white blood cells is mono. Okay, mono is also called infectious mononucleosis. It is not cancer, and it typically hits younger people, 15 to 25. This is often called a kissing disease because it is actually spread through saliva. So it's not just kissing, but also sharing a straw or a spoon. Think of your teenage girls, you're in the lunchroom, and it's not a big deal to take a drink out of somebody else's Starbucks cup or taking a bite of, something off their fork. It's not a big deal between girlfriends. And this is a way that mono spreads with, of course, kissing too. So again, teenagers, this is a common thing with teenagers. What happens with this one, your white blood cell count goes up slightly. Remember, 5 to 10,000 is normal. We're talking 12 to 18,000 in this diagnosis, so just a little elevated. And this one takes a long time to heal. You just are going to feel very fatigued for a very long time. It just takes a long time for your immune system to completely get rid of this one. You'll be fine, but it's just, you're going to be exhausted for a while. Okay, the next section is called platelets. So remember the formed elements were the red blood cells, and then your buffy coat was your white blood cells and your platelets. So that's where we are now. Platelet is another name for a thrombocyte. Thrombo in med term means clot. So these are your clotting cells. Obviously very important. If you cut your hand, we need it to clot, or otherwise a little paper cut can make you bleed to death if it doesn't clot. So big deal. So how does clotting work? Blood clotting is a chain reaction, which of course starts with the cut. Your body likes homeostasis. Homeostasis means keeping everything normal at a steady level. Okay, that's what your body likes. However, we do lots of things that cause our body to come out of homeostasis, and a cut is one of them. Last module, we talked about the negative feedback loop versus the positive feedback loop. Normally, when something isn't normal in our body wants to get it back to normal. So if I get cold, my body makes me shiver to warm me up. If I get hot, my body makes me sweat to cool me down. However, with the cut is an example of a positive feedback loop, which means something is not normal in our body, but we need it to be that way. we need to fix the clot, which is going to return us to homeostasis, but we actually need our body to do something special, the blood clotting. Okay, so you remember back to our plasma proteins. There are two plasma proteins having to do with clotting. Fibrinogen, and prothrombin. That's what I just did that PFAG in my head to come up with that other word, because that's how it works. Okay? So these two plasma proteins are in our blood all the time, circulating in our blood, ready to make a clot at any time, because we can cut ourselves at any time. So this is how it works. The body recognizes that the injury has happened. So the body will release this prothrombin activator, because this prothrombin is in our blood all the time. It's not active. It's not making clots. We have to tell it to make a clot. So the prothrombin activator gets released. The activator combines with calcium. So you better have calcium in your blood, which is why it's so hugely important. So the prothrombin activator combines with calcium, and it converts prothrombin to thrombin. The thrombin combines with fibrinogen, which remember is already in your blood, and it creates fibrin. And the fibrin attaches to the cut and creates the clot. Here's kind of a blown up version of what that blood clot looks like. And they use the word like spider web. Okay. So all of these are spider webs that fibrin makes. And then the platelets, the thrombocytes, get caught in the spider web and clot, and that's what makes the scab of the dried blood. So, in order for this entire process to work, your blood has to have three things in it at all times. Fibrinogen and prothrombin are your plasma proteins, and you have to have calcium. Must be present in your blood at all times so that a blood clot can be created when it is needed. That's why two of our hormones, which you learn about in a different module, control calcium. Okay, so we're going to talk about the terms thrombus and embolus. They are not the same thing, okay? Thrombus is a blood clot inside your body. And that clot is probably attached to something. It's stuck to the side of your vein or your artery, and it's sitting there as a blood clot. That's called a thrombus. The condition is thrombosis. However, that clot can dislodge from where it's attached to. So that clot can come dislodged and start circulating through the bloodstream. That is called an embolus. The condition is called embolism. That's a big problem because that clot might make it to your lung. And we call that a pulmonary embolism. It can disrupt your entire oxygen supply for your entire body, which can be fatal. A pulmonary embolism, which you'll hear called a PE all the time on Grey's Anatomy. They threw a PE. That's a fatal condition. So while the thrombus, when it is stationary, stuck to something, maybe it's down in my leg or something, that's serious. But it's more serious if it starts circulating in my body. That blood clot can make it to my brain. That blood clot can make it to my lung. And it could kill me. All right. We have, I already talked about the heparin, warfarin, Coumadin, which thin your blood. So some patients are prone to blood clots, those thrombosis we were just talking about. And if that patient does not have a clot, they're just at risk for it, we can put them on some of those blood thinner medications. Great. However, if they already have a clot, those medications aren't going to help. What that patient needs is a TPA. Okay? This is somebody who already has a clot. And these medications are intended to help dissolve a clot that already exists. So one stops a clot from happening, one treats the clot once you already have it. For any patient who is on a blood thinner, they regularly have to have a prothrombin time test taken periodically. This is going to take blood out of their body and test its ability to clot. What we don't want is for you to be on a blood thinner that makes it too restrictive for your body to clot. We still need you to clot if you have a cut. My dad was falling a lot at the end of his life. He had a couple of brain bleeds, and by him being on a blood thinner, it made him very, very at risk for brain bleeds that could prove fatal. So patients on these types of medications need to be monitored very closely that they're not on too much medication. Okay, hemophilia. Hemophilia has to do with failure to clot. These patients are missing those clotting factors in their blood, the prothrombin and the fibrinogen. They are missing one or both of those proteins. So without having those proteins, you can't clot. Remember, I told you had to have three things active in your blood. Prothrombin, fibrinogen, and calcium had to be there. If you're missing any of them, you have clotting issues, which means a small cut could kill you. Okay? So, it is an X-linked disorder, meaning that it affects men more than women. Not to go too far into genetics, women are XX, men are XY, meaning women get two X chromosomes, meaning we have two opportunities to get a healthy cell. Men only have one X chromosome, they get one opportunity, and if they get a cell that genetically carries a disease, they will have the disease. So any disease carried on the X chromosome is going to affect men more than women. Okay. Typically, you take it from a mother who doesn't even know they have it because they have a healthy gene to override it, so they don't have the disease. And they pass it on to the son. The son gets that XY, and the son gets the disease. Okay. There's lots of diseases carried on the X. This is just one of them. And so the patient can't process those plasma proteins. So this type of patient needs blood transfusions of the clotting cells, clotting plasma proteins, to give them artificially what their body cannot produce. This patient, all they need is plasma. They do not need the full blood. They just need the plasma. So all the people who donate plasma probably go to this kind of patient. This disease, very interesting side effect or side note on this disease. The hemophiliacs were the second group, well, I guess third group, to come down with AIDS back in the 80s when AIDS was brand new. You had your IV drug users and your homosexuals were the first two groups getting this disease. And people thought that was it. The third group was the hemophiliacs, because they would get these blood transfusions. AIDS got into the blood supply. They weren't testing for it because nobody believed it could be in the blood supply. And then the hemophiliacs started testing positive for AIDS. And they said, wait a second, these aren't IV drug users, these aren't homosexuals. Why are they getting this? And they realized AIDS is in the blood supply. And that's when they started testing all blood donations for AIDS because of the hemophiliacs. And so it was, while it was terrible and unfortunate, it was a great discovery for all of us at that point. Next one is called thrombocytopenia. Penia means reduced amount. So this means you have a low platelet count. This can cause problems, obviously, if you have a cut, you can have slow clotting responses. This happens with people with compromised immune systems, AIDS, HIV patients. It can also be if your bone marrow was destroyed by drugs, chemicals, radiation, things like that. Okay. Oh, vitamin K, very important. Vitamin K is also a big part of clotting. It has to do with combining with those thrombocytes. So your vitamin K is actually present in your liver and stored in your liver. And newborns sometimes have problems with this. They'll test for that. Okay, so now let's go through your top takeaways from this chapter. Know the composition of blood. Your plasma is your proteins. Your formed elements are your red blood cells. And your Buffy code is your platelets and your white blood cell counts. Know that the normal blood volume in a normal adult is between 4 and 6 liters. That's why you can donate some and still be healthy. You can't donate all of it, obviously, but you can donate a liter and you're okay. Your body will make more within a couple of days. Know your plasma proteins and the function of all of them. Don't just know what they are, know what they do. Your white blood cell counts, know the difference between your granular and your agranular. Okay, no, we're good. And what they do. Know the term hematopoiesis, which means formation of blood. Your red blood cells, they carry the oxygen. They live about 80 to 120 days, then your body reabsorbs them. 4.2 to 6.2 million is a normal red blood cell count in a blood sample. And know the hematocrit and the hemoglobin. Know your blood types. Know your blood types. Say that again. Know your blood types. Know the difference between antigens and antibodies. Know what giving the wrong blood type can cause it to clump, which is the term agglutinate. I don't think I said that when we were actually lecturing. The word agglutinate means to clump. Know about the Rh factor. Know that the concern is the Rh negative mother with an Rh positive father, and then the fetus is positive as well. But note, if the mother is positive, no concern at all. So when I was talking about how some of you may have experience with that RhoGAM shot, if you've had a child and you don't know what I'm talking about, then your blood type must be positive. Because if you were negative, you would know about those shots. Know about your anemia. Anemia simply means low number of red blood cells, but know the difference between hemorrhagic, aplastic, your deficiencies. Know pernicious needs B12, folate needs B9 and iron. The hemolytic, know sickle cell and thalassemia, both are genetic. Sickle cell, and I didn't put it on here. African American is the highest incident of people who are born with it, and thalassemia is your Mediterranean descent. Know your white blood cells. Know what leukopenia, leukocytosis, and leukemia is, but remember I told you did not need to memorize the 4 kinds of leukemia. Your acute and your chronic lymphocytic, lymphoid or myeloid leukemias. You don't need to know those. Specifically, know leukemia as a category. And then platelets and thrombocytes. Okay, the last thing I want to show you is if you go to this website, there's a really cool game on blood typing. And I'm going to demonstrate that to you. So we come here, it says these people have just been rushed in from a car accident. They're rapidly losing blood and urgently need transfusions. And it is your job to get their blood type and give them the blood. Okay? So there's 3 patients here. I'm going to pick the first one. They must have been at a Halloween party. So I'm going to draw her blood. And then I'm going to put some in each of these blood tubes. Okay? And then I'm going to look at them. And this one looks like this. This one looks like this. And this one looks like this. So I need to figure out what her blood type is. Okay? So the RH looks like this. B, A. And then this is what each of the bags look like. And I have to come through these and decide what is her blood type based on what I saw in the tubes. And then when you're ready, you're going to pick her blood type. You're going to give it to her. And hope it doesn't kill her. Great. Everyone can receive the universal blood ORH. She needs another bag of blood. Can you give it to her? So they don't like the fact that I picked O. I'm going to pick this one. Yes, you can only give RH negative blood to a patient with RH negative blood. She needs a 3rd bag of blood. Can you give it to her? Well, I'm going to give her. Hope she can have this one. I think this one's going to kill her, though. Oh, no. Oh, no, they want a 4th bag. Great, I'm still hoping I don't kill her. I've gotten lucky so far. Oh, wrong blood, I killed her. Okay, so it's kind of a fun game. We can reset the tubes. We can take the next patient. There's a little bit of sound to this that, of course, you guys can't hear through the speaker. But it's kind of a fun game. So if you have a moment, put it back up here. Okay. And have fun with it. I always think it's fun. We always do it on the video cart in the classroom together. So nobody's on the spot. They typically will volunteer to come up and hey, we all laugh about it. I mean, we all made mistakes. I mean, you saw I just killed her. So, kind of fun. All right, so that is your blood chapter.